Hi, Dr. Wendy here with Empowered Life PC. Today we're going to go over the second exercise or stretch during pregnancy that I recommend for most of my patients. This exercise or stretch is in order to get our psoas muscle, which is a hip flexor in the front of the pelvis. So in order to do this, we are going to first need a blanket, a towel, a pillow, something that's got cushion to go up underneath our knees that are going to be down on the floor. So, cushion. You're going to start out with going down on both knees, and then you're going to bring one leg forward to get into kind of like a lunge stance. Now, in order to perform this correctly, it is not just coming straight into a lunge. That's not going to get this muscle. First, we have to set up our pelvis to be in the correct position. So most of us, due to our sedentary, more sitting lifestyle, we have an imbalance in our pelvis, which is creating more of a tilt of that pelvis down, where our pubic bone is facing more down versus forward. So we have to take that tilt out. So in order to do so, you're going to kind of contract your bum muscles, but work on using your abdominal muscles to lift that pubic bone up. So it looks like this. So here I pull it up. I feel a little bit of tension or tightness through my hams, my quads, as well as in my glutes. So now my pelvis is nice and straight. Then we're going to make a movement in coming forward. Now here I hit a wall. I can't go quite further, but I am going to push a little bit more, and then now I start to feel that stretch. When I have this nice and stretched, and you're probably going to feel it more through this groin area here, you're going to count to 30 before you release it. So 28, 29, 30, and release. And then you're going to switch sides. So bring that leg down, bring this leg out. We need to correct that tilt in the pelvis, so we're going to contract and bring that pubic bone up. And then we're going to come forward until about right there where you feel like, and you can push through this and overdo, and that's taking your tilt out. So if I push forward, I can go forward, but in order to do that, I feel my pelvis release and my pubic bone drop. So you got to make sure you're holding that contraction to keep that pelvis straight. As right there, I come forward and I hit a wall. So I'm going to push into that wall a little bit. I'm going to count to 30, 28, 29, 30, and then release. And you're going to go back and forth like this on both sides, doing it starting out 3 times on each side of 30-second count holds. After you do this, if you're really, really sore, you want to keep it at that for a few days. Once you start to feel a little less tenderness or soreness or achiness in there, then we can increase it. The idea is to do it anywhere from 5 to 7, maybe up to 10 times, depending on how tight it is on each side for 30-second count holds. Thank you.